Welcome everybody to Addicts Helping Addicts, episode 5, brought to you by New Beginnings. I'm your host, Kyle. I'm a recovering addict. With me always, KJ, our co-host. So welcome everybody and thanks for watching. Today we're going to talk a little bit about mental health, a little bit about substance use disorder, SUDS, and yeah, we're going to get into some topics, talk about, the way we raise our children in this generation, day and age, with electronics and such things to cope with being at work so much, being being at work so much in order to provide a better lifestyle for our children. So it's a big vicious cycle. And on vicious cycles, we're going to talk about how mental illness and addiction play a key role in one and the other. Um, Science nowadays has been saying they're going to attack the issue together. Attack addiction with your mental health instead of attacking treating your mental health and then treating your addiction. They say you need to get your addiction out of the way before you can treat your mental health, but some people say you have to get your mental health out of the way before you can treat your addiction. But some people are now saying, start treating them at once in a vigorous, effort to, treat them both. So yeah, we're gonna get into some topics today and discuss a few things. So thanks for being here and enjoy you guys tune in.
Hello, everyone.
So yeah, I guess if you want to get a little bit, you want to jump into it and describe this episode and get into a topic, and we'll jump into it.
Yeah, so mental health and addiction, how the two work hand in hand. Um, yeah, so pretty much, I think today that I feel like everybody knows that today you don't have mental health without addiction, and you don't have addiction without mental health. Typically, when we see people coming in for treatment, or simply people well, we don't want to say in general. No, let me not say in general. That's not because if most people, I want to say it this way. If we're dealing with someone who's not seeking treatment for mental health or addiction, chances are both of them are occurring. But if you're obviously getting treatment for your mental health, there's not going to be, there shouldn't be any substance usage. So for those who are not getting treatment for their mental health or addiction, the chances are two are together when they come in for it. Um, a lot of times people go into treatment and they don't always get their mental health addressed, especially since sometimes they're in treatment for a short time. So a lot of times that's also going undone, untreated. I mean, they do like provide medications and whatnot, that the treatment center is primarily geared towards substance use. Most of them are co-occurring, or they say they're co-occurring, but the mental health component is really not always strong. So they'll come in and they'll get treated for the addiction, but they may not get the mental health part. And so they keep moving on through treatment and they're still struggling with their mental health. And so the process is kind of like repeated again if they fail relapse or not because they're still struggling. So, and then what people need to understand, because it's just not that simple. A lot of times, the most common types of mental health is anxiety and depression that most people tend to deal with. And so, that's a lot of times why you may find people that are using because they don't want to feel depressed or anxious. Um, but chances are they're also not dealing with that depression. And there's a lot of reasons for it. Again, it could be insurance, it could just be access to healthcare, just a lot of things. So, yeah. Um, yeah, it's something that I think it's something that is acknowledged, but still just not understood, by most people. So I think we should just talk about it, and just really just kind of like really see if we can try to not see if we can understand, but just just I guess discuss it.
Yeah, absolutely. It's definitely a controversial issue because a lot of people say it's in their genes or, you know, um, but pretty much like if you have a mental disorder, some people will relate to using, to mask their mental disorders such as anxiety or depression. And the more they use, the more they'll damage their brain, which in turn will, worsen their mental disorder. And it's just a vicious cycle. So learning to get out of that cycle and treat first your mental illness or your addiction, it'll be easier to treat the other. But now they're saying it's better to treat both at once. That's the new way of going about it, I guess.
Um, well, I think
They're
it's always
trying to attack both at once. Is what they're saying. Like in the new treatment centers, they want to address both issues at once because they're saying you first can't treat your mental illness without getting addiction out of the way. But some people say you can't treat your addiction without first getting the mental, vice versa. So now they're going out this process where they want to attack both issues at the same time.
um and
That approach to it.
well, okay. So I guess what everybody should understand is always going to be multiple schools of thought to addressing one problem. And I don't want to say one is right or one is wrong. However, I mean, obviously, if the substance abuse has been severely devastating, where it's almost getting you on the brink of death and you can't get back on your feet, so you're going to treat the most severe thing first, which would probably be the addiction for most people. Then after you stabilize, then sure, then it's the mental health. There shouldn't be a really wide gap between treating after you treat one and treating the other because one is a catalyst for the other, depending on which one is primary. So, I mean, if a person who's primary mental health, just meaning they have bipolar, schizophrenia, whatever, and it's causing them to use, you'd still have to treat both because physiologically they've been using, so now their body's, a bit damaged. So you have to obviously stop that. Then you stabilize them on their meds and you try to address what's going on because most of the time they may have seen a psychiatrist 3 or 6 months ago. Something happened, so they don't have access to that psychiatrist anymore, so they don't have access to their meds. And many times, and rightfully so, psychiatrists cannot continue prescribing meds to somebody they have not seen, at least in the last 12 months to a year, you know.
Yeah.
So rightfully so, if they have not seen their psychiatrist in the last 12 months, they're not going to get anything. And so this is what causes a spiral. And sometimes, people also have an issue with taking their psych meds because there's a lot of claim of they don't feel like themselves. They feel like they can't feel anything. They feel numb. That may be true. I haven't taken psych meds for long periods of time, so I can't say it's not true, right, at all. But I don't think there's any real education behind the benefits and outweighing the cost. Um, so I think that's also another issue. It's one of the things like why as a nurse, I'm really big on patient teaching because if you explain something to a person, they're more likely to probably follow along if they feel like they know exactly what they're getting into versus you just say, take this, it'll make you feel better. So, uh,
Yeah.
uh, but yeah, overall, ideally, you should be tackling both. But when it comes to the substance abuse, once you get that under control, it depends on which one is primary. But once you get whichever one's primary under control, you should be able to deal with the other one. And if they're both strong issues, you may have to deal with both. So that means a person would be dealing with their addiction with if it's opiates or whatnot, it would be Suboxone, while we're also dealing with their bipolar with, whatever combination of medications. So it could be you will have to deal with both. There's never really always gonna be one or the other, but sometimes if you deal with the substance abuse, if it's primary, a lot of times the mental health is acutely secondary, which just means it just came on and it will go away when the drugs are completely out of the system, depending on how much damage is done to the brain.
Oh, substance use disorder, SUDS, there is a mental health disorder, and they're saying which leads to addiction. So like substance use disorder, like being addicted to, compulsion to things, and you can't just have a little, so you get addicted to certain substances, and then it leads to addiction. Then it damages your brain, and then which is a vicious cycle, and then it worsens your mental health, and then yeah, and then you use more, and
So, yeah, I probably should have opened the DSM-5. So, yeah. So, we're talking about all the steps that lead you first up to the actual um, di diagnosis of being addicted. Because there's a series of questions, a series of things that have to be asked. So, a thorough assessment has to be done for the psychiatrist or whoever, whatever doctor to say, okay, you have an addiction. An addiction has many, I mean, to stay on the point of substance use disorder being a mental health addiction, yes, because it has to do with the brain. So yes, when you get to that point, yes, if you've been classified as having an addiction and now your body is physically dependent on it, and we're looking at, okay, for 6 months, have you been doing this? Have your relationships broken down? Have you been able to keep a job? Are you finding yourself making a lot of impulsive decisions? And so we're also looking at this trail of things happening as well before we say, okay, you are falling under classification of an addict, you're addicted and all this stuff. On top of how long have you been using certain meds and all this, or whatever substances. So, yeah, I mean, once it gets to that point, then yeah. But I mean, when treating addiction, I mean, it's still physiological, so still like a medical issue. So we still, once we're dealing with the physiological part of the addiction, which is trying to slowly separate
yeah,
your body from those chemicals, so that's the
yeah,
first. So that's the physiological medical part of the addiction. And once we do that, which obviously takes about a week or so, now we're dealing with the part that has now become the mental health aspect of it, which is, we're talking about now, what's going on. There are people who, again, there are people who can't balance the euphoric sensations that they get from using. You know, they don't know how to stop. So we're trying to deal with that brain chemistry, the brain
yeah,
brain reward system. So
yeah.
simply,
They're factors.
so simply put, if you have a cigarette or you have some ice cream and you enjoy it, typically you're satisfied and you don't go back for more. But some people, and they get in there just, ooh, I have to have it again. So that ice cream was good. I want another helping. But that
Yeah, their
cigarette,
reward centers in the brain is damaged.
it's on this. It's not that it's damaged. It's that some people just overindulge. And yes, the thing is like it's really like, okay, it's really very easy to get your brain to get stuck in something. So, and it can happen with anything. So sure, it's not that it's necessarily broken at that point. It's just,
Well, I'm not saying it's broken. I'm saying it's damaged. It's
yeah, well, damaged or broken. So just example, if you like pizza,
still repairable.
yeah, so if you like pizza a lot and you can't stop eating a slice, and it's just like, and your wife is like, stop, and then you're like, it's so good, you know then we're looking at a problem that's developing, is that you can't stop having a slice even though you're full. You had that good sensation, it was good, it was satisfying, you should be done with it. For addicts, they don't know how to stop, even if it's gambling, like the thrill of the potential of getting that one bet, and even if you do get it, it's still not enough. You still got to try to go bigger and bigger and bigger and bigger. So it's the lack of knowing when to stop and stopping at the previous. euphoric sensation you had already, and it's like you got to keep going. So that's
Yeah.
what that's what we're looking at when we're like, okay, we can classify you as an addict, you know. And but when it comes, I mean, and clearly with the example of gambling, it's not necessarily substances that break it because the gambler is an addict too, addicted to gambling, but he's not destroying his brain with substances. He or she is basically overindulging with their addiction to compulsion. So I think there's just still a lot of work being done as to what's going on in that area of the brain, but definitely has to do with the overflow of the dopamine.
It's just weird. That's like a vicious cycle, you know. Say you have PTSD and then you start self-medicating, you know, to deal with your PTSD, which, you know, used to be called shell shock, I think. Or what's the other one for it? Shell shock back in the war, and then manic depression. Now they
Uh,
call it PTSD or so. Oh, whatever. Or no, I
um,
mean, it's like bipolar. Yeah,
yeah,
looking back.
it's a bipolar, yeah.
So let's say you
Yeah.
have PTSD and you start self-medicating to deal with that. So because your brain's damaged, you know, because of the trauma you experience. So you're going to self-medicate to the point where you're going to need to self-medicate more and more and more to the point where you're damaging your brain, you know, which is in turn going to, you know, make your mental illness worse. So it's just this vicious cycle.
So when you have so the brain is like a unique, very unique organ and still not figured out at this point. The brain has this wonderful ability to create new pathways whenever we experience, learn something, or whatever it is. So when we learn something, we create new pathways, new areas, new connections of neurons develop every time. So the more now with the drug use and all these things, and what's going on in the brain when people are using is that you're disrupting the natural way that the brain is creating these
The
pathways.
NA book, there's saying how the brain technically heals itself. Like you change your way, you know, your everyday life about being, you know, honest per se. So, you know, how you're a dishonest person, if in every situation you start changing your, you know, your behavior and you start being honest, eventually your brain is going to find it weird when you're dishonest. You know, it's not going to feel normal and you're going to, you know, tend to be more honest and stuff, you know, so the brain can heal. It's just about changing your way
Yeah,
of thinking and getting those new neural pathways built.
yeah. So some people have yeah. So
Because
yeah.
I know I used to lie all the time. Like, you know, I used to lie, cheat, steal. And now it's like, I catch myself thinking like, oh, I want to steal that. I'm like, no, I can't. I can't. But back in the day, I wouldn't even, you know, consider it twice or like lying to people. You know me. I'm very honest and it gets me in trouble sometimes. So like, oh, I shouldn't have said that. Oh shit. You know? But 5 months ago, I would lie my ass off to get $5 to go use. You know what I mean? And now it's just like I feel it weird when I have to put myself in a situation where maybe I could not tell the truth all the way, or you know, or lie. It just makes me feel uncomfortable. So
Mhm.
it's my brain healing, and I just it's weird realizing, understanding that, you know.
So yeah. So yeah, I mean,
But it was in the NA book, the Living Clean book. There was a little reading in the beginning, and I was like, oh wow, that's me, you know? Like, oh, weird. Because I find it weird when I go to lie, and I'm like, I keep lying, I can't lie.
mhm. So it's yeah. And most people don't, you can when you self teach yourself all those things, you create those new pathways in your brain. And so there's obviously a deeper science about it that, won't get too much in, but, what people need to understand that, and most people don't make a choice to evolve and grow. Some people like to stay where they are. So when you choose to, change behavior, learn something new, whatever it is, yes, you create new pathways, um, you change some things. And now it can be a struggle because I also want to just make sure people know that yes, a lot of our behavior is motivated through hormones and our neurotransmitters and all these different things. So
Survival instinct,
Hmm?
survival instinct too.
Yeah, I mean, there are some things you just can't help. And so the reason why I'm saying that because people who deal with that situation are people who suffer from schizophrenia and bipolarism. So yes, the normal person, for the most part, has a level of control. There are a lot of things that, that you don't have control over. But in general, we are typically born with a normal functioning brain that's, and, an endocrine system that secretes normal levels of various hormones, the way it's supposed to. That's why we have a general baseline as to how, in general, how a brain should be functioning and how everybody should be behaving. That way we know when it's one these few people are not, it's like, okay, then we know there's probably something going on with their brain chemistry or their endocrine system that's causing them to behave a certain way or their body to respond a certain way. So I just want to also make sure that we don't, so much that we understand too that there's just only so much that we also have control over. So, but yes, for the most part, you can do some rewiring and you learn new behaviors and you stick to it. Yeah, if it's somebody who's doesn't typically have a conscience and now they actually start to think about the same things that they say or they do, yes, but that does take some effort to stay consistent with that. If you keep that up, that's the new pathway you've created in your brain for that behavior.
Yeah, I know they don't like to refer to this term in rehab, but fake it till you make it per se. Where you just keep doing something in repetitive nature, and eventually your brain will get tricked into thinking, oh wow, and then you'll release those same chemicals, like the reward system, like, oh, I'm doing good. But
Um,
I want to bring up this reading. What is this? I don't know. It's an article on mental health talking about trauma and how traumas that we experience may actually change our genes and actually, make our next generation more susceptible to things like substance use and, you know,
you said susceptible.
susceptible.
Mhm. Mhm.
Like the trauma that I went through with my best friend Kobe, before my daughter died. That could have changed my genetic makeup. I could have passed something along to her, like where she has that trauma and, embedded in her genes too. Like where, you know what I mean? So she's more susceptible, to use drugs, which scares me. I mean, I know it's not the case, and it always depends on certain genes and XY chromosomes and who carries stronger genes and stuff. And sometimes it skips generations. And I understand all the variables in genetics. I'm just saying, it just scares me that something that I experience could potentially affect my offspring. It's kind of crazy. It's just kind of a cool little study I wanted to bring up.
Yeah, it's just yeah. So I think the simplest way to explain that to people, just think about medical disorders. When you eat certain foods, the way we eat now today is so totally different the way we've eaten maybe 100 years ago. We eat so much more processed foods. There are a lot more chemicals in our food than there used to be. It's why we have now a lot of genetic um, def
Deformities.
mutations. Um, so we're eating all these chemicals over time when they started really getting into processed food. So the first generation of whoever you came from who was eating that was rewriting their genetics. They had kids that kept going and kept going and kept going. So now you have these developments. That's the simplest way to put it, to try to explain that. So yes, at and our entire existence is chemicals and cells. And our cells learn. They remember things. It gets encoded. So yeah, it's possible that behavioral and yes, the use of substances, all that stuff can be passed down. But that's the controversy still, I believe, right now
Yeah.
that people still think it's not true. But that's the why I use that example with food, because we did not have the kind of chemicals we have in food the way we do now. And that's why, and we use vaccines, we use a lot of different things that we did not used to put into our body. And so that's why some believe with vaccines they cause autism. So the introduction to certain chemicals or changes in a lot of ways that we live, the environment, yes, it rewrites our body. and there's a potential. It may skip because it might be a weak change, it might be a strong change in your genes, and you keep passing down. Depends on how dominant your genes are when you mix it with someone else to make a child. So it just depends. If your genes are weak and your partners are stronger, that's where it may skip. If both your partners possess that gene, likelihood that your offspring will have it. So it just depends on that level. But yeah, and that's what people need to understand too. It's like that happens. But again, I don't think everybody's really educated on that, and that's why
Yeah.
everybody thinks that
I just
you
know
know.
it made me feel a little better, I mean, not looking at it as like an scapegoat, like not blaming it all on me, my actions and the things I've done and my choices obviously put me in the situations and the addiction I was in. But I'm saying like it kind of gives me like a little peace of mind knowing like maybe it wasn't all my fault. Maybe because my father was an addict and a drug dealer. And there's drug use on my mother's side. I had brothers that used. Family members, cousins. Just alcoholics in the family. You know what I mean? Just it was all over the place. But I'm a firm believer of you're a product of your environment too. I mean, what you were raised around, you're gonna grow up, and I mean, you can break cycles, but
So right. So it's not necessarily false. So that's where then you come across to that crossroads of nature versus nurture.
yeah.
So you're the family, and that's why we take we do an assessment. We try to gain your family history because we're trying to figure out who in your family may have experienced this to see how predisposed you are to the potential. So yes, with addiction, if we know that your father, brother, anybody else use, because of you being in proximity in an environment and or father, mother, grandpa, aunties, anything like that, then we know, okay, there's a chance that this runs. That's why we consider that. Which speaks to the fact that yes, we do understand that there is the potential for it to be passed down genetically because we understand
Yeah.
that. So yeah, the nurture part is okay, how does that person recognize that before they go down the same path? At what point? And sometimes it happens when they're a child and they don't recognize because they're depending on the parent to guide them. So if you're a child experiencing this, you probably have no chance. But if you start a little bit later, maybe, to recognize everybody in the family that's doing it on maybe like, okay, I can speak as I'm a perfect example.
Yeah,
Uh,
so
yeah, so my dad was an alcoholic and whatnot, and I don't know past him, but I know he was. So
and
uh,
not to pick up, because you have that gene maybe.
yeah, so I know I have the potential or predisposition to it, genetics, whatever you want to call it, because I paid attention to other things I enjoyed. I overly indulged in video games like crazy when I was young. I could play 20 to 36 hours and not eat, but I was a kid, so I was being taken care of. You could still say I was an addict because we're talking about addiction in the sense of what does it
Oh yeah,
destroy.
compulsion. Yeah, take
I
up
would
your time. It destroys your everyday life. Yeah, it ruins your routines, eating habits.
So I recognize the fact that I could play games for such a long time and I didn't eat, I didn't drink anything. I just got up to use the bathroom from sun up to sundown, you know, and that's what I did. So I saw that. Now, I'm not saying that at my age I saw that, but the potential for addiction's there. Addiction is addiction. It's just what is going to be your poison, you know? Um, so yeah, I recognize that. And as I started getting educated and working in the healthcare field, I was like, okay, that's what that is. Okay. Now, I will say this, sure, when I had a taste of some alcohol, I think the only thing I've ever done really is maybe some weed. So, um, but just even the taste of that, the potential even kind of sparked there a little bit like, oh, wow, this actually feels good. So I have to be very mindful of things that I overindulge in because I know that I can let myself go. And if I let myself go, then we got a problem. So, but everybody's not equipped with what I have. And that's the kind of problem. Or they
Yeah.
everybody have people around them that's educated to know. And it's not to say that if you find your child or your son, because, well, you find your child overindulging in video games that you have to be like, oh my God. No, you don't have to. But you
No,
teach,
just beware of the signs, you know.
well, you just teach them moderation. I didn't, yeah, just like, be aware, make sure everything's going right around them, make sure they're, and I would say nothing was, I mean, my upbringing wasn't perfect. All in all, it wasn't perfect, but all in all, I won't say that I was like this depressed person who just lived in darkness, but it was a very hard upbringing, very hard.
Yeah.
So, but everybody deals with their life differently. So I don't want to minimize somebody else who may.
Oh no, you just turn to, video games and, isolation to deal with your, rough upbringing. Other people, it's an addiction, but other people, lean towards marijuana use and opiates and, you know, deal with their
Yeah,
trauma, pain.
yeah, but what I'm saying is I just don't want, like I said, my example of video games, I don't want someone to become overly like reactive, like, oh my God, no. Because honestly, I'll be honest with you, video games have made my brain the sharpest. I'm not gonna lie. My brain is extremely sharp because of video game playing. I just overindulged in them so long, but I recognize the whole point is I recognize. And so everybody doesn't have that. Everybody's not able to self-recognize, or they may not have that around them to say, hey, let's go ahead and slow down a little bit on that. So that's just what's important. Not to play helicopter over a person, but it's important to be able to, monitor that. So yeah.
We were talking a little bit about PTSD earlier, but after I experienced that explosion and lost my friend Kobe, it kind of like made me. I'm gonna talk about this, but I'm gonna talk about it. So after Kobe died, and I had dealt with him dying in my arms and bleeding out, it was very traumatic. And then my stepdad shot himself when I was home, and my mom he shot himself in the doorway of my mom's room in his room. He suffered from depression for many years. He was an alcoholic, and the signs weren't even there. You know what I mean? Like he was happy. He always said people that committed suicide, it's the coward's way out. But anyway, getting back to the subject, like I cleaned up the blood and hair and stuff because no one was gonna do it, and I did that. Like it almost forced me to grow up. So some people are saying that it's called post-traumatic growth, where you experience something traumatic, but it changes your brain where like you experience, something positive out of something negative. I guess it's from the old saying, whatever doesn't kill you makes you stronger. So we were talking about PTSD, so I just want to touch base on like post traumatic growth.
Okay. Well, I had to look that up because I've not heard of that. But so it's supposed to be a positive psychological change experienced as
Yeah.
a struggle with trauma or highly challenging situations.
Yeah. The positive psychological change resulting from the struggle with challenging circumstances and life crises. And that's kind of like when I read that the other day, I was like, oh wow, that's kind of what happened. You know what I mean? And just like after years of destroying my body and brain and with its addiction and just the bad choices, that I made over the years, it's like it was such a negative thing. Now, moving forward, I just want to take that all that trauma and stuff and put it into something positive. So it's almost like what is it? Post traumatic growth. Yeah, I just thought that was kind of cool. Made me feel a little good. Like almost like a phoenix, something rising from the ashes, something good from something nothing.
Mhm. Um,
I know it's not a mental disorder,
oh no. So yeah, most people with PTSD, I mean, how do I say this? Because the issue is there and so everybody experiences bad things and you process it, you go through different stages to process it. And at some point over the course of at least maybe 6 months, some people take upwards of 12 months. You should have gone through all the different stages and come out fully processing it and understanding whatever meaning comes out of it. and some people can't, and it depends on the gravity of it. So some people have experienced assault, some people had to be forced. And see, there's like, especially let's use, I mean, the veterans, they go into the army to defend America. Okay, so what does defending America potentially mean? It means potentially taking someone else's life. Everybody, and they know that going in. Those who actually have to actually physically go on the ground and do that, they may actually have a moral barrier or mental barrier that says that's the line that they don't want to cross. But in the army, what do we understand? They have to follow orders. So now you force them to cross those barriers, those mental barriers. Could you go out and go kill somebody just because, even if they made you super pissy mad, unless you had to physically defend yourself, your life or someone else's, would you kill someone? I'm asking you.
Oh, I wouldn't.
Okay, why?
Moral compass?
Okay, so all right, so we're asking veterans to break their moral compass,
Yeah.
the safeguard in their head, the lines they won't cross. They know they're going to have to cross that line, but they still go in and do that. So it's just that people who have these barriers in place, compass, whatever you want to call it, that line that they won't mentally cross, it crosses. And so their brain just breaks down and they can't process it. They've done something terrible and they've had to do it over and over and over. So they're constantly, constantly breaking and crossing that line over and over and over. How Think about how that can make you feel. Like you can't get past it.
Yeah. And it varies case from case too. Like I know some people they're saying how PTSD, like you're saying war, like flashbacks. Some of them are stored in the hippocampus when they get PTSD, so they're vivid, like in the short term memory storage. You know what I mean? The front of the brain. So they're stored right there. So it's like the images and the flashbacks are vivid and stuff too. So I know it varies case to case, but it's definitely not something I want to deal with. Yeah.
Yeah,
Luckily
so
for me, I still remember everything vividly, but it's just not. I don't think it's in my short term or my yeah. You know what I mean?
yeah, so I mean we normally will, I mean when something happens, we'll still experience, memories of it and flashbacks, and it shouldn't really bring it to a certain place. But some people, again, if it's rape or something done to you or something you've done to somebody else, and these barriers are being crossed, and your mind, you cannot process them and get past it. So you're always reliving them and reliving them. And so so your brain's inability to process it and move forward is, I'm trying to keep this in simplest terms. So people out there, I ain't trying to be super scientific. I'm trying to keep it simplified so everybody understands. So your brain can't get past it. So you just constantly are reliving, and that can be just very, very tormenting, very tormenting. So there's still like, they're not even really understanding still why it happens and triggers. So I don't want to make it seem, I don't want to explain it where like this is the reason. It's not. There's so many
Yeah.
different.
Yeah, so many different variables, case to case, and person to person, and chemical makeups. Yeah, I get it.
So there's just a lot of things that can happen, different concoction and mixture of things, stressors, things. But what we do understand a little bit is that they can't get past it. They can't process it. So they're just kind of stuck, constantly reliving. Again, using simplified terms, they're in a time loop. It's
Yeah.
constantly over and over and over and over, and it cannot get past it. So, um, you know, that could be hard. So what again, whether it's bipolar, schizophrenia, PTSD, what do we want to use to stop seeing, feeling things?
Now, does someone with, let's say, anxiety use, more than someone with PTSD would, or just someone with bipolar or schizophrenia use? You know what I mean?
Do they
Like,
use more?
I want to know, like, let's say I had anxiety and my friend had depression. Would I be more out to use more than they would? You know what I mean? Abuse drugs more to cover up my mental disorder? Or would you know what I mean?
So in
Or
general,
would it just vary case to case?
I mean, in general, everybody who's, for the most part, everybody's going to have that component of using because they don't want to feel anything and they don't
Yeah.
want to process and think about anything. It could be other. It will probably. There's such a cauldron of things in there, but one ingredient is probably going to always be consistent. I don't want to feel it. Now, who's more likely to? Well, the person who's anxious, if they realize that the substances help to kind of alleviate the anxiety, they will
Yeah.
probably go for it. The person with depression, you know,
I guess it depends on how severe the depression is and how often it comes and goes, I guess.
well,
Or if it's, manic depression or not manic depression,
so we're talking about what stimulus do what. Okay, all of the drugs create this euphoric feeling. It feels good. Okay, so they all end in the same at the same.
epinephrine, endorphins, yep.
Yeah. So we're all ending there. Whether I'm depressed, I don't want to feel depressed. I'm going to get high. Or I'm going to use stimulus, keep me going, get me going, or opiates, whatever. Each one does something different, but they all end at a euphoric feeling. Okay. So whether it's the person who's anxious, we're wondering what's going on with this person. Why are they in overdrive or hyperdrive? What's going on in their sympathetic nervous system, maybe? What's going on? What? Yeah. I mean, it's not specific, but I'm going to speak for this. Some people they're always in overdrive. Understanding the fight or flight situation. Anxiety just has to do with this overstimulation of being on alert. You
Yeah.
know, are you always alert? Why is everything always? Why are you looking for the worst to happen?
And
What's
the
going on?
constant fight or flight, stuck in that fight or flight.
Yeah. So
Constant.
yeah. So now, unfortunately, I have to say this because this is a problem that we have in America. We abuse words. So everything is classified as anxious. I'm anxious. I'm anxious. I'm anxiety. Now you can work your you can you, the term is somatic. You know, you're just working yourself constantly. Things are not even there. Now you can work yourself into anxiety too. You can. And some people are used to just working themselves in. Nothing's even happening, but they just work themselves into it.
Differences between like actually having anxiety and just feeling anxious.
Like stress is normal, anxiety is normal, depression is normal. These bad feelings we have are normal. It's just how long do they go on is the question. That's what we look at. If they're going on too long for no reason, that's when we're looking at, okay, what's the problem? They're all normal. So when someone is constantly saying that they're anxious when there's nothing really going on, like life is going to happen, I can be, if I choose to, I can just be anxious about life all day long. That's not a way to live. So that's why I say some people abuse these terms because if I experience something that makes me anxious, I don't, I'm not going to say I have anxiety disorder, but I
I do
think,
notice that about this generation or this day and age, everyone has a disorder and has to have some diagnosis. They can't just have a bad day. They got to be depressed. You know what I mean?
yeah, so, and there is a lack of education with the doctors with this, and the fact that we are trying to be so, I think that this whole crusade to now be mentally help be aware of mental health, it's a bit late and it's then we're being hypocrites. We people, this is kind of gonna go steer off, but I need to make a point. We expose ourselves to things that cause us stress. Social media has been great. It is a wonderful tool, but everything that humans get their hands on, we abuse it. So you have kids at a young age who have a phone, who are exposing themselves to so much information that they do not need to be exposed to. And you wonder why they behave the way they do. Your parents give their kids phones, they don't monitor what they see. Kids see all kind of things. They experience anxiety, depression, paranoia, um, all these things, and no one's there to process them through that.
Yeah.
You're leaving a child to figure out how to deal with the level of stimulants that they're seeing. stimulus that they're seeing. Yeah, that's a problem. So today, because of that, because parents let their kids be raised by phones and devices, you have kids now who are anxious and depressed, and they're getting on these drugs at a very early age. But you can't tell a parent that they've done that wrong because that's a hit to their ego.
I know for me, they wanted to put my daughter on depression medication, and I was against it only because when I was younger, I went through everything. I saw a psychiatrist, and I was on Abilify, Lexapro, Concerta, Paxil, you name it. They put me on it, and they jumped me around so much that I was getting mad. So when they brought up that, they were like, "Oh, you want to put your daughter on depression medication?" And I was like, "No, because like I just like I outgrew it. You know what I mean? Like I don't know. I don't think I was really depressed. Like I was saying, they were just like, "Oh, you're sad, you're depressed," and they started throwing medication at me. That's what I was saying. This misconception of, like
Mhm.
you were saying, the doctors are, need more education on it or misinformed.
Yeah, most and sometimes it's not always a psychiatrist that's prescribing these meds too. It's a person.
I
It's
think
just
it's a money thing too. You know what I mean? The more they push, they get cut
uh,
back too. So
yeah,
that
that's
it's
true.
a different topic for a different day. Anyway,
Yeah, no, yeah, it's true. But
big
yeah,
fun.
because it's something that's even more in depth. But what I'm saying is that it's not always psychiatrists who are prescribing these things because every every special every area well every specialty I won't say every specialty but a doctor a doctor has to in a sense choose a pathway to go, but they're all doctors, whatever specialty. Even a psychiatrist is a specialist. They can prescribe certain meds, but most people who choose a specialty stay in their lane because they don't know any more than because they chose a specialty. So a lot of times there are doctors who they're not psych doctors, but they'll put them on that because they can.
Yeah.
Um, and they shouldn't. But the thing is, yeah. So you have ill-trained doctors or doctors who don't do a full assessment. So one of the biggest issues in the medical community relating to doctors is that they are not doing full assessments on people in general. And then when we're talking about kids, you're not getting a full assessment. You're not getting doing a complete history and physical or anything. You grab a little bit of information and then you decide to start prescribing. A lot of kids, and especially it's not that when you hit the legal age of 18, your body's done maturing. We do understand about there is a certain age, I mean, not age, there's a certain point, it's different for everybody, but there's a certain point that your body does kind of like stop growing and developing, and you reach that point. So, what do we say? The brain stops developing the brain is fully developed around between 24 and 26. I'm going to give a range 24 and 26. We have parents who are just like, fix my problem. I don't know what to do. I don't know what to do. And when you have parents like that who just lose it, that is not good. That's not good. I'm sorry. I'm sorry, parents out there. If you hear me, that is not good. You cannot freak out like that. Just say, please fix my child. That's not how parenting works. I'm sorry. So when you have parents like that who just say, well, okay, I'll try anything. Mm-mm, mm-mm. Now, if you have a doctor that's a psychiatrist that has done a full, like if you really took your time to have a child see a therapist and a psychiatrist, let them do a full assessment, complete. If we come to something that's truly wrong, okay, you caught it early. That's fine. But if there's no full assessment being done, and how do you know if you've done a full assessment? Get one or two opinions.
Now they got a dependency.
Yeah, if that goes wrong, and if that medication goes wrong, guess what? They're going to probably try a street drug because now their prescribed medication, they don't think is working, but they get a little taste of something else because somebody else said, "Oh, this makes me feel good." That's that. These are just different ways, It's just it's terrible because it's like I said, it's not always as simple as addiction starts off with somebody being depressed or somebody just they start off with fun. Sometimes it could be that person who was put on medication too early. They decide it's not working. Somebody tells them, "Oh, try this. It makes me feel real good, girl or guy, whoever." They try it. They're like, "Oh, it does make me feel good."
I was just thinking back when I stopped and they put me on all those different medications, they jumped me around. I was just realizing that's when I started smoking weed.
Oh,
I didn't
okay.
even think about it. I was like, I got to a point where I just didn't need him anymore. No, I just realized I just wished, one for another. I just found the one that worked, I guess. you know.
And that's the potential outcome. So it's like, addiction can start in so many ways. So many ways. There's just no way. Everybody tells their story, and that's how you figure it out. So the story is going to be so different for how everybody starts. It's not going to always be necessarily be trauma. It could just simply be what we just described. You putting your child on a medication too early, then one or two things happen. They decide they find something else that actually makes them feel much better than the one they were prescribed, or something else. But it's just so different. Um, so
Looking back at all the people that I used to use with, I just realized most of them have experienced trauma, or most of them, had a rough upbringing, or most of them have, schizophrenia or depression, severe depression. Looking back, it's like we're all like the misfits per se, but there was a few, rich people that had a good upbringing that were in the mix too. But look, most of them had issues. I had issues. We all got to work through them.
well,
But
also,
that's what I'm talking about is working through your mental disorders so you can then tackle your addiction disorder. You know what I mean?
yeah.
Or go the route, that they're suggesting nowadays, tackle both at once. But I find that it's going to be a rough route. It's going to be a rough time. I know just handling one at a time was rough, but it helped me, to get clean, starting to process and deal with and understand some of the traumas and things and emotional states that I've been in my past.
Okay. I think I might understand what you mean about the tackling at once thing. Okay. Yeah,
Yeah,
I do.
tackling your mental disorder and your substance use disorder at the same time. That's what they were saying. That's how they're trying to go about it in treatment. What they're looking at it in the article I was talking about. But like I was saying, it's tough enough just tackling your mental health. Being open and honest with it. And they're saying people don't realize it takes 10 years for them to actually come forward and tell and seek help for their mental disorder. So now they're trying to get it at a younger age where, notice the signs and have you be open and honest and, not feel so embarrassed to come forward with your symptoms, say, hey, mental disorder is, perfectly natural. It takes people around 10 years to come forward and actually seek help.
In general, because we're
Yeah.
talking about cultures, gender, a lot of stuff, socioeconomic things. There's a lot of factors involved. So yeah, and it's probably going to continue to take 10 years. And the thing is that there's two sides to this because you can write an article and say this, this, and that, but you got to also address other issues. You know, everybody doesn't have equal access to healthcare. Everybody doesn't have that equal access. We're literally still fighting about is it fair to give somebody healthcare even if they are not working. We have a certain population of Americans who think you should be busting your ass like this to get decent healthcare. You know, it's not a right now. So there's factors involved where you live. You have, unfortunately, when it comes the African American community, majority very religious. So see addiction as something spiritual to address it that way first. Prayer.
Oh yeah, demons cast the spirit out. Yeah, you got a bad demon inside you.
Um,
Different cultures, anyway, it's different.
yeah, I can't speak to all the other religions, but I know with an African American culture, whether it's American or the African culture, we're talking about deities and spirits who are involved with the afflictions. So we're dealing with those in that community. I can't necessarily speak to any other religious, so someone from those backgrounds would have to speak on that. But generally speaking, most
Yeah.
religions, most religions are people, most cultures and their religions can also stop a person from going to treatment because it may be seen as a sign of a weakness, or they may feel like, well, this is what you get for not following this religion. So it's seen as a punishment. And if I just go back to church or something like that, this will all get better. So you just have to, each culture is different. In America, yes, a melting pot of cultures. So you never know whose culture you're dealing with when as to why they're not getting treatment. So there's those factors right there. Like I said, the healthcare part, gender wise, will men typically step up? No. not first, will not go into treatment first. You have to do a lot. I can't speak to women, so I'm not a woman, but there's also their barriers that they also deal with. So there's different things to address, which I don't think are being addressed properly to make people feel comfortable. Now we have new emerging things. So we're talking about now. Oh, I said gender. I already said gender, but now we're emerging with more genders now. So we're also talking about the LGBTQ. So now there's not a lot of um, facilities or yeah, facilities, and we're battling with that to make them feel comfortable. Specifically transgender to come in. So there's just so many existing and new emerging issues that make it hard for a person to say, I have a problem.
Yeah. I just think we should like introduce like something like the DARE program into schools, to like, get kids familiarized with some of the symptoms so they can come forward at an earlier age. You know what I mean? I don't know. There's got to be something. There's got to be some sort of way we could tackle the mental disorders in America, or at least address it so younger generations can notice the symptoms earlier and actually look for a way to seek help at a decent age, not wait 10 years.
So, I mean, yeah, I grew up when Dare was on the
Yeah,
program.
me too. But you know what? I don't think that worked. That's why I said something like it because there it just I colored the little joints in the booklets and I thought it was so cool and I cut them out and I put you know what I mean? It was almost like they
Yeah,
glorified use.
yeah,
I tried not to, but I didn't do a good job of.
well, no, the program, no, well, yeah. So, no, I mean, a program, well, see, oh God, we also live in a country. We're the only ones we're still behind. We think that our kids are dumb, but you want to expose them to devices and TikToks. So you want to let your children get on TikTok and see the most perverse things, but you don't want in schools for them to talk about stuff like drugs and all that stuff because there are kids in school with them who are using. But you're okay with them being on the phone, scrolling through TikTok, seeing things, and you don't observe them to that. So I'm sorry, I'm going to say something again. A lot of parents today are just really being dumb. They really are. You let your child have a phone at a young age, exposed to all type of content, but you're against them having a conversation in school about the things that they're experiencing now with their peers. A lot of kids are having sex right now, smoking, all that stuff. That's happening in school, but you feel like you should be teaching them at home, but you're not teaching them at home. You want to fuss and fight about, I should be teaching my child this. We'll teach them because when they become an adult, they go out struggling, not knowing what to do, or they're afraid to even come to you. So there's a lot of teaching on both sides. There's a lot of teaching. The reason why I even probably now even sound more passionate about that is because when I deal with people coming in, I get a chance to listen to their stories. A lot of times there are parents, and I understand living in the US that we live in a country that pushes you to work. You're not a successful or great person unless you work 50 to 80 hours a week. And if you have kids, that's supposed to be the sacrifice, is that you have to bust your ass working crazy, so you can't even raise your kids. So we live in a world where parents are having to work two jobs or whatever. No one's they can't watch their kids. So a lot of parents also leave their kids with devices to keep them company. And so these kids are just not being great. They're not having any moral development. They're being allowed to let their friends guide them into growing up. So they're
But my question is, what do you do though? Because we live in this social norm now where these kids go to school and their friends have it and stuff. So you're a bad parent if you don't get your kid. You know what I mean? So you can't just separate your kid and have them be an outcast either. So I understand where some of these parents are coming from. So there's got to be certain age barrier, certain ages and limits and certain things they're allowed to do with their phones and certain times that they're allowed to use them and stuff. I get that point of view. You know what I mean? But you can't just be like, no, everyone around you's doing it, but you can't. You know what I mean? It just kind of, I know it's hard. It's definitely a sensitive subject for sure.
I don't think it's sensitive. It's just what it is. That's called parenting. You don't let your child do what every other parent is letting their kids do. Because you can use that same logic and say, well, since your friends is having sex, go ahead, go ahead.
Well, that's why I was saying moderation and time limits, and when you reach a certain age, you're allowed to do this much time at this time. You know what I mean? I think having it more structured. I want to speak on this because I have a family member that does not allow their child Facebook. This child's not allowed to,
Hmm.
and now this child is 18, and they kind of like sheltered it a little bit, but this child turned out great, but they had those things in place, in moderation.
So social media is very brand new as being a part of people growing up. So social media was coming into play, I say,
2005,
mm,
2000.
I mean, the internet and us being able to go on the internet, I remember was coming into play
AOL.com.
the late 90s. 90s, because I remember when I was in school, they had stuff letting us do college classes, and you had the internet. We can go to websites. Social media itself, like all that stuff, was still coming in, but we had access to the internet and a lot of information. It didn't get wild until you had a phone in your hand.
Yeah.
Everybody started having a phone in their hand. It's got wild. Okay, so here's the thing. Is parenting hard? Yes. Is there any way, one way to do it? No. But here's the hard part of parenting. The thing is, you can't be the cool parent. You have to be a parent.
Yeah, you can't be a friend. I learned that with my daughter.
Yeah.
I learned it the hard way. You know what I mean? Because I was befriending her, and it just,
Yeah.
you know,
Yeah. So
I would let her cross boundaries. I wouldn't let her cross being a parent.
so the thing is that when we're talking about, okay, when I'm talking about who I deal with in treatment, it's because a parent just was not, you don't have to be a helicopter parent. You don't. But the thing is that if you let your, we, we say this every day. A child can't do certain things at a certain age. They are not legally able to do certain things. Okay, there's a reason for that. Because why? Because kids do not have the proper, they have not developed the proper.
And they're impressionable at that young age too.
A child can't do certain things at a certain age. They are not legally able to do certain things. Okay, there's a reason for that. Because why? Because kids do not have the proper, they have not developed the proper.
And they're impressionable at that young age too. So you don't
Why do
want to
you
shake.
think why even though other countries do this in America, it's just an instant charge for anybody over 18 to date someone under 18, right? Why do we
Yeah.
say that? Because we say that kids are incapable of making those type of decisions. What's retarded about that is that we're very strict on that, but we're not strict on everything else that can damage a person. So if you're okay with the logic that anyone over 18 should be punished for dating anyone that's even 17 or whatever. If that is that strict, why is everything else, why are you leaning on everything else that can be just as damaging? So the logic behind well, you don't want to make the child feel like an outcast or somebody else who saw Facebook and then yes, but the social media is a new thing. So now there's a new risk in place. Now your child is probably a little bit more prone to developing these things we're talking about, anxiety and depression, influence to using because it's on social media. You know, there's a dark web that exists. You
Oh
know,
yeah, they're drug dealers. I see it all the time with people I used to buy.
oh
I have unfriended a lot of people, and they're still posting things online. And I just came across a couple of things on an addiction website the other day where this lady's daughter overdosed buying fake pressed fentanyl pills. They were labeled as Percocet on the street, but they were actually fentanyl pills, and she overdosed. So these kids are buying it through social media sites and the dark web, like you were saying, and so you got
so
all these younger kids accessing these things at their fingertips, and then leads them down a rabbit hole. What if they get hooked on Percocets from their mom's medicine cabinet? Like I know I was using prescription pills at a young age, and then now I can't find any prescribed, so I go on the street or oh hey look at a Snapchat and meet this person here for some Percocet, and then it could be my last Percocet. it's scary shit. We what we allow our children to put in their hands, and it's gonna cause depression and mental illness, and
So the fact that you even said all that, the fact that you even said all that, then that's where you break your other argument down about, well, if I tell my kid no while the other ones are doing it, I don't want to do that. That's one of the things when we as adults with kids have to realize.
that's
And
why I said it's hard. It's
that's
a
why I
hard back
said
and forth.
it's not hard. It's not hard. It's just if a parent is trying to be the cool parent, that's why it's hard. See, back in the days when, I say 50, 60, early back parents, let's say like this, parents would whip some ass. And they didn't even allow if their neighbor whooped the ass because they said we raise our kids like a village.
Yeah,
Okay. So there was an understanding of, who's a child and who's a parent. Today, we live in a world where the parent wants to be the child's best friend. They don't want their child to be mean or mad at them. And it's like, I'd rather you be mean, mad at me now than to know that I'm letting you out into the world, probably messed up with anxiety and depression or predisposition to use or anything like that. So it's not hard. It's just if you have the mindset of I want my child to like me and I want them to, because a child, once they learn that they can wound you by saying I hate you, I don't like you, and that wounds you, that's where the manipulation comes in. That's probably the earliest onset of learning how to manipulate. As we grow up as children, we learn, we pay attention to stuff, and we may weaponize it as kids. We don't know no better. We don't know no better as kids, and if we see something we can weaponize, we'll use it against our parents. That's just being a kid. Yes, as the parent, we should be able to recognize that and say, "That's okay. You can hate me. That's okay. I rather
yeah,
you hate me. I rather you hate me and whatever." Now, you know, if they want, that's the whole idea behind being a parent is you have to guide them. They will grow up, they will understand it, they will. We all do, you know. Now, there are some parents who do all that and their child still becomes Freddie or something, but that's a different thing. But all in all, sticking to the sticking to this issue right here, person going towards addiction, is the majority of it start as a child potentially? Maybe if you can dig that far back, if there's something that's happened, sure. um is it something that could have been preventable? Probably. Is there some mental illness going on? Or probably. Depends on how observant you are. um but I think that to give a person the best shot, at least in the earlier parts, because if it's mental illness, if you can correct it early, again, by getting two or three opinions to make sure that there's some, everybody's being unified on what they're seeing, then okay, then we can establish an intervention and probably prevent this person from going down a destructive path. If they have bipolar, schizophrenia, or something like that, we can probably prevent that, give them a better quality of life. Because with a lot of the mental illnesses, we're talking about a brain chemistry issue. So if we can kind of like stop that brain chemistry issue from getting way out of control, then we can give that person a better shot. If it's addiction, if there's no mental health, if there's an addiction, if you find your child withdrawn or whatever, if there's, or something like that, those little signs, whatever it is, if you can be more observant. I know life in America is hard because it just makes the people have to, there's so much to do, so much working, but to the best of your ability, if you can be observant, you can see the little changes that happen that you can probably catch it. Is your child succumbing to peer pressure? Are they trying really hard to be cool? Make sure your child knows that they don't have to try to be the cool one. They don't have to try and fit in like that. Be mindful of who your kids are hanging around. To the point of when you were talking about people who have money, I was going to say I took care of people in California, in Malibu, who came from money. Their problem, and it's crazy, when you have everything you want, you're bored. What do you do when you have everything you want? You're bored. You want people to like you. Typically, your parents hush you up with money. What do you want? Here, use my credit card. Those are the stories I heard. So I mean, every background's different. But again, one thing I have, well, I'm hoping I'm not steering off, but one thing I have noticed in general when I've worked with people in treatment, they love structure. As much as they fight against it, they like it because it's where they come from, a place of no structure. And once you put structure in place, it's more appreciated. So a lot of the people I used to work with, even have money, they had no structure. They had no one around them to say no, no, you can't. They're used to getting what they want, So it's also putting structure in place. So that's another thing too. A lot of people I work with, they want you to tell them no. They want you to stick to it because they want to know they can't run over you. These are the little things that I notice. Very appreciative of. Like, oh wow, you really care. You really care that you're telling me no. Like you even spoke to it too. That while you were mad when your mother would tell you no, you're glad that she didn't. I mean, you're glad that she didn't cave in. So yeah, those things are important.
Yes, just be aware of the signs at an early age of, possible mental disorders, and be aware that having a mental disorder may lead to addiction. So be mindful of that. And addiction will damage your brain, can and will damage your brain, into the point where it's gonna, make your mental disorder more severe. So be aware of that vicious cycle, and don't let your kids have video games. No.
Yes. All in all, I think it's really good. I mean, addiction can start at any age. There are people who never use until they've gotten an accident and broke their leg. But a lot of people, it does can stem from childhood and trauma. So, for parents who, just it is about being more involved and, definitely kudos if you're trying to work two and three jobs or go to school and raise kids. But if you
And that's
can't,
what it is too. It's this whole world we're living in now, where the price of living is so high. You know what I mean? So you have to have three jobs where you leave your kids unattended, and you don't know what's going on in their lives. And our world's just so busy where we forget to slow down and actually realize what's going on around us and realize what's important. You know what I mean? We lost sight of that because we're too busy paying our rents and trying to provide a life for our families. So we're not aware of our kids' mental illnesses, which may lead to their addiction. It's just we got to keep an eye on things like that and be aware of it.
yeah, I mean, the best thing I can probably say to that, if you are a parent who has to work two jobs and go to school or whatnot, it definitely would help to get your kids involved in after school programs or get them involved in volunteering. Because if you can't physically be there, if you know that they're involved in positive, productive activities, that can help.
Yeah,
So getting
not structured, especially if their life at home is not as structured, like you were saying earlier, to talk on that point.
But leaving them to video games and whatnot or their phones, no. But honestly, everything I just said, and it's not gonna hit because the phones are the easiest thing to give your child. But for those parents, just be like, get them involved in karate, get them involved in volunteering at a church or at a homeless shelter, get them involved with doing service work, something like that, so that for whatever time you're at work in the day to the evening to when you get home that you know that they were involved in something productive to the best of your ability because you can't stop a child from skipping out. But to the best of your ability, you did that. You can get them involved in after school programs if you don't have anybody
Well, that's hard too, because my daughter, I tried getting her into sports, not interested. I tried getting her into, like you said, karate, not interested. She wants to just be left alone in isolation, listening to music, playing her video games, and so it's hard. I mean, I know case to case it varies.
yeah, and that's where you have to just become the parent.
Yeah, pretty much.
Become the
Oh yeah,
parent.
we drag her outside. Like, come on, get some sunshine on you.
Yeah,
That's
and
her grandmother says, "Come on, let's blow the stink off you."
mhm. Yeah, to every parent, I keep it generous. To every parent, that's where you be the parent. I mean, it's okay. It's nothing wrong. Like I said, I play video games and all that. It's okay. that's where you start to pay attention to the balance. It's just the balance. It's like you always in your room, or you always locked away. That's where it's like, okay, yeah, you need to get out and get a little. So, but yeah,
Changing the way your behavior. We're talking about the way your brain changes and the way your thinking changes and your structure, whatever. It's self love too. You know what I mean? In rehab, I got a haircut and I felt good about myself. I got my cream for my psoriasis. I was feeling good about myself. You know what I mean? So going back on changing the way you think and the way your brain changes. Self love is a really big issue because you can't. I don't know. It's hard to love other people around you and love what you're doing and love the world if you can't love yourself first.
so yeah,
So I know it's hard for some people, but you got to put that effort into actually caring about yourself and caring about your appearance and going back to structure. Making your bed makes you feel good about yourself. Picking up your space. Because was it you that said no, 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 it was someone else. But they said their house is a reflection of their mind. If their kitchen's messy, you know, then they're having a bad day.
I say that, but it wasn't me. But yes, it's very true. So yes, for the most, I want to say for the most part, not in every situation, because I don't want people saying that your house is dirty, so you must be. No, but for the most part, most people who are truly organized cannot have a disorganized environment. I would say an environment. That's why some people have a hard time working at certain jobs that are disorganized or anything like that. That's why a lot of us, if
Well,
we walk,
I'll be honest. As an addict, 12 years of my living environment was horrendous. You know what I mean? Like I didn't care. Lived in filth. I didn't care. Like I had one priority in life, and it was drugs and feeling well.
Mhm.
And like I said, I was a functioning addict for a while until I wasn't.
Yeah,
Until shit fell apart, and then I just didn't care. My house was like a hoarding house. I had boxes stacked everywhere, dishes, you name it. It just didn't matter to me. No power on. It was horrible. So
yeah,
now that I'm clean and not using, I try to make sure my environment is clean. You know what I mean? Like I just it's something I wanted to change for me, and it makes you feel so much better if your environment's clean. You feel like you can think clearly. You don't feel so depressed, and you know what I mean. That's what I was the point I was getting at.
yeah. Like
It's self love, loving yourself so you can actually love other people and love your environment. Make your bed because it's some structure, and you need structure in your life to actually pick you up in certain times.
yeah, I mean, yeah. Well, and that's also about also taking pride in yourself. So you're talking about also taking pride in yourself and your stuff. So yeah, when you make your bed, your bed's not a complete mess. When you look at it made, you're like, oh yeah, I like it. It's clean. Whatever it is, keeping yourself looking sharp and clean, getting your hair all done up, whatever that means. So these are just different things, and things are important for different people. So yeah, I mean, and it's all a part of mental health as well. So yeah, I mean, self-care, basically, blanket statement, but self-care, yeah, it's important. Self-care of
Yeah, that's
yourself.
what I was saying because like when I was using, I didn't care. My psoriasis was a mess. My hair was overgrown. You know what I mean? I didn't wear clean clothes. I didn't wash my hand. I just didn't give a fuck. To put it in simple terms, I didn't give a fuck.
I
I don't care
wouldn't.
what people think about me. I had one goal in life, and that was it. So once I got out of rehab and actually started to care about myself and started working out again and started, getting a haircut and putting my cream on and actually taking the time to care about myself, it actually lifted your spirits up. You know what I mean? So I know it's hard for a lot of people suffering with depression. I hate myself. I'm ugly. Give yourself a chance. Start building up you know what I mean, your emotional self. Like start building yourself up to where you can actually start feeling genuine love for yourself. You know what I mean? Because that's a big state of recovery. Is actually self love, taking care of yourself, and making sure you feel good.
you know, it's good to surround you with people who check in on you, who are there, who, you need that. It's never good to be depressed and by yourself. So I don't make it sound easy. So it's difficult. And again, it's different from the person who's depressed than the person who's dealing with depression for 2 weeks or longer consistently. So yeah. But to what you're saying, yes, when you do those things, you start to feel, you do feel better when you can clean your house, when you can go out. That's why I love shopping for clothes, and I need it's turned into a compulsive thing. No, it's not. But I like shopping for clothes.
Yeah.
Like, you know, because when I lose a little weight and I'm like, ooh, and I go and get me some clothes, and I'm like, well, this fit nice, just like I did today. I bought me some clothes. And so I like that. So, um, you know, it's a long process. Let me say that. I don't want to make it sound simple. It's a long process because if you're afflicted with a mental health issue that keeps you from enjoying life, I don't want to make it sound simple. So
Yeah.
we have to address those things first. So if you have a mental health, if you have struggling mental health, you know, if you have questions, again, I want to make sure I say this every time we do an episode. I am not any authority, although I am a medical professional. I am not acting as any one singular authority. But if you have any questions about stuff, please reach out. There are resources out there, even if you don't have, I think it's, and what I understand with people with depression, it can be very hard to even try to get up and look for it. So if you need someone to talk to, if you want to just open up, for sure, because it's not easy. I realize it. Just getting the energy to even do what we're talking about, cut your hair, or clean your house, that's probably a mountain to climb for you. So don't want to make it sound simple. But yes, if
Absolutely.
you can get in the habit of doing those things and really start to train your brain to see that as a positive.
Yeah, I mean, it doesn't have to be all at once. Just start little, just give it a chance and do little tiny things, and eventually, like those tiny little stepping stones will lead into leaps,
Yeah,
and
so
we'll tackle bigger issues.
it's just really about really just getting into it and staying in it and being committed to it. And I'm going to try to use simple words, retrain your brain to actually find joy in putting on makeup, find joy in want to try on clothes, find joy, in I don't whatever it is. And that's how you try to like really do self-care, getting rest, you know. Um,
But not
yeah.
too much rest. Not too much rest where you're just sleeping your day away, being all depressed. I know it's hard.
Yeah.
Anyway,
Yeah.
one of those things too where people are always like, just recover. Oh, just stop taking drugs. Well, yeah, I may be an addict, but you don't understand why I am an addict. Maybe I have bipolar. Maybe I got some underlying issues you don't know about. You know what I mean? So it's very hard and a touchy subject, very controversial. Like Kareem said, we're not professionals. We're just giving our opinions and, maybe a little bit of information, help better equip some of the daily struggles you may experience having mental disorders and addiction disorders, substance abuse disorder, which is a mental illness.
Mm-hmm.
Suds. Not soap suds.
Mm-hmm.
Not beer suds either. No drinking, no beer suds.
I am just not an authority, but I am a professional. I'm just not. I'm not a singular authority, but I am a professional in the field. So, but I just don't want anyone to think that I am speaking any specific
No.
ways that you should do things, and it's the all end of if you don't do it this way, you don't. But it's just again, we have to be aware of these things. Yeah, so we definitely want to keep the conversation going. So for sure, reach out to us.
Yeah, we did have an issue the other day on our page too. People were arguing and fighting back and forth. So I just want to point out again that we're just here to give our opinions and other people can share their opinions, but please don't fight and argue. There's no point of it. Life's too short. And yeah, we got a lot of great things coming up, a lot of great things in the works with new beginnings and establishing something there. So we'll talk about that in the future. And if you want to see more of this, or if you'd like to be a guest on A.H.A, please reach out to us. If you're a struggling addict and you just want to talk about your life story, or you want to tell us a story, or maybe you're an addict in recovery and you want to share what worked for you in your recovery and what helps, just reach out. We'd love to hear from you. We'd love to do an interview. So just, yeah, absolutely. So thanks for watching, everybody. And if you like what you see here, make sure to like, share, and subscribe. Make sure to turn on the notification bell. And yeah, it works if you work it. So work it, you're worth it. Thanks, everybody.
Take care. Again, till again.
You If you would like to support New Beginnings by ordering a t-shirt, you can do so by emailing us at newbeginning113023@gmail.com, or you can call New Beginnings at 802-829-0034. You can also find New Beginnings on Facebook, Instagram, and also on YouTube. New Beginnings hosts the Narcotics Anonymous meetings Sunday nights at 6 p.m. via Zoom. You can find a link on the Facebook page. Thanks everybody for your support.